Hi YouTubers. I want to talk about an abscess tooth. I'll tell you, this tooth here created me so much grief, and there was no relieving that grief. The only way I could relieve it was with cold water in my mouth. And you see that decayed spot there? It already had a filling in it. And then this piece here was decayed, seriously decayed. There was no fixing it. I was advised that a root canal could take place, but it's all inside the tooth itself is just rotten, basically. See how far that goes inside there? And the reason why you create so much discomfort is that in these roots, you have some nerves, and on this side of the tooth where the decay is, well, they died off pretty fast. But then there was still the other side that has roots, and they were still living and surviving, and they didn't die off. So they were trying to survive, trying to die off. They were kind of getting confused, and during that confusion, it created, my goodness, it's just unexplainable, the feeling it gave me as far as a bad tooth. So I couldn't deal with it anymore, so I said, that's it, the tooth has got to come out. And here it is. Here's the tooth that came out, and am I ever glad it came out. Instant relief. Once I got the tooth removed, which was, well, actually it never created any more grief right from the point it was removed afterwards. Now what you want to do is, when you get a tooth removed, you're going to end up with a blood clot in that hole, and you want to be careful. You don't want that blood clot coming out. So you don't want to spit, you don't want to suck on a straw, you don't want to suck hard on a cigarette if you smoke. You know, you don't want to jar it tremendously. You want to keep that blood clot in there until it basically firms itself up. If that blood clot removes itself, you don't want to stick your tongue by the hole. You want to do whatever you can to make sure that blood clot stays in there so it can do its process that it needs to do, which is basically turn to bone. If that blood clot comes out, you end up with a dry socket, and I never had one, I never experienced one, and I don't want to. From what I understand, they're not very pleasant to feel. Very, very, very painful. So if everybody wants to escape this type of tooth issue, I would suggest don't let your tooth get to this point. Not a good idea. Get it fixed or get it removed, even though it's not bothering you. When the day comes and it's going to bother you, you can guarantee these words, you're not going to like it, and you're going to be looking for an escape of some kind. I'll tell you, this tooth here gave me months and months of grief. The first grief is when the first set of roots here were dying off, and then it cleared up and was feeling pretty good, and I was able to chew with it, no problem at all. It wasn't bothering me one bit. And then afterwards, about maybe 3 weeks after the first real pile of grief it was creating, well, then these other roots on the other side of the tooth started acting up because they were trying to die off, and at the same time they're not super exposed to anything, so they weren't really able to die off, so they kind of lived. And then it would go away, and then it would come back, and then finally the last process, I don't know if they were dying off or not, but I didn't wait the process out. I decided just to have the tooth removed, and I definitely would encourage everybody that they don't want to go through this. It's definitely not something you want to feel. Definitely not. If you want to, it's your call, it's your choice, but I know what I'm going to do next time another tooth gets to this point, or even close to it. It's coming out. I don't want to get a root canal, because what they have to do basically is, carve out everything in the center, and then they're going to go into the roots and pull the roots out, and then they're going to basically fill it with like rubber posts, and then what you end up with is just a tooth in your mouth, and it's basically just sitting there almost like a false tooth. But I've had a couple of them also in my mouth that had root canals, and over time they just fell apart. So, and it was a real nasty mess removing them ones. So I'm going to encourage everybody that Well, root canal is not always the best way to go, and I'm not interested in any more root canals, that's for sure. I'm going to have mine removed. It's the best thing. It feels the best also, and that's my step, and that's what I'm going to do. So everybody that's watching this video can decide for themselves what they're going to do with their teeth. But I'm telling you, I wouldn't wish it on anybody, the grief that this little tooth here can create. This was a back molar tooth, right beside the wisdom tooth, but I don't have any wisdom teeth, so it's the next one. It's basically the molar. And it's been fixed. You can see the filling in it. And that held up for, some good years, for sure. And then eventually just a great big old chunk fell off the tooth there. There was another tooth beside this tooth. And yeah, that's the results. So am I ever glad I'm holding this in my hand, looking at it now, thinking to myself, this tooth isn't going to create me any more grief. What a good call that was. I dropped it. So it's up to everybody watching the video. It's your teeth in your own mouth. Do what you want with them. But I tell you, the words I'm using, there's no piece of artificialness to it. Take care, everybody, and thanks for watching. And if you haven't subscribed, please do so. Many more videos to come. Take care, everybody.